From a man in hospice care sleeping on the floor to malfunctioning and missing call bells.
Well, they moved into an assisted living facility expecting what the company advertises as the highest levels of respect, care, and attention.
But a WCNC Charlotte investigation found Somerset Court of Cherville might have failed to live up to that promise for some of its residents.
You don't get no help when you need it.
It should have never happened, and it did, and I can't bring her back, but we're all sad.
From a man in hospice care sleeping on the floor to malfunctioning and missing call bells, WCNC Charlotte's Nate Morabito discovered multiple people are now sharing concerns about conditions inside the Gaston County facility that's home to dozens of people.
I really enjoyed it.
When Stacy Reeves walked through these doors,
I really cared about them.
it felt more like visiting her
Okay, so she's an employee.
grandparents than a job.
I'm trying not to cry
Which is why she says
because I would have wanted to be there.
it breaks her heart
I do feel bad.
that she wasn't working.
That's a man on the floor. And what I will say is there is a hospital bed next to him. And I'm wondering a couple of things. See, when I read these stories from these news outlets who don't understand healthcare, it's always, they're just saying, this is terrible, this is terrible, this is terrible. But it's like, that's a picture. Was he out of the bed? Did he roll out of the bed? And I'm not saying any of that is right, but you don't have enough, from what I'm seeing, it's not enough information for me to go out and say, the hospice company sucked, the healthcare facility sucked. Like, that's not what I'm saying. I don't have enough information for that.
The day one of the residents passed away.
Because I bonded with him.
Reeves says she at least takes comfort knowing, because of her, this man wasn't on the floor when he died.
This actually looks like he was set up to stay on the floor. I'm wondering if he was rolling out of the bed a lot and they don't have fall mats. Again, something that this was a hospice shortcut. And the other thing too is to differentiate between, was it a hospice company problem or was it a facility problem? This seems to be a bad hospice company, one that needs to be looked at, right? If you are putting people on the floor as a hospice company, that's pathetic. That's absolutely pathetic. It's a lack of empathy for the patients when they need you most. We continue to talk about these hospice companies and the shit that they try to keep doing to people, but this is next level insane.
I was told that he was put back in the bed.
The former Somerset Court of Cherville personal care assistant says the facility took her off the schedule in October after she documented the hospice patient's sleeping conditions.
He would say, get me up, get me up. He would just holler.
She says she took this picture of him partially on the ground and partially on a mattress in the days before the 74-year-old's death.
I couldn't leave him on the floor. So I
would love to find her. This is fantastic. I would love to talk to her. This because the other thing, and this is what I always say, the people in healthcare want to do the right thing. A lot of times it's the companies that are the greedy ones. And so when you have administration of people at your C-suite levels who are money first, people second, you have shit like this that happens. And it happens far too often in communities. I would love to see the actual income of that community. Because what happens too many times, and how long that person was on hospice, right? They really don't do well with people that's been on hospice a long time. I talked about that earlier when they bring dementia patients on and kick them off because they're tired of them and they're too expensive. The way they treat certain communities and certain people, it really has to be done better, which is why, again, we have to come up with a program that it will tell us the truth. Google reviews are not enough. It's just not enough. For healthcare, it's not enough.
took it upon myself, helped him into the wheelchair, picked the mattress up, put it on the bed.
Reeves says she recorded the eventual conversation with her supervisors.
I care about these people. I really do.
She says during that meeting, management told her a doctor ordered the resident to sleep that way due to...
Oh, you know what I'm thinking? Healthcare Anonymous. Like, I mean, the shit is getting crazy, right? Like, we gonna have to.
being a fall risk.
We can't go against something that the doctor says, and whether we agree with it or not.
In the recording, they said this was the only alternative to keep him from falling out of bed.
Yeah, that's what I said. And again, I don't watch this. I watch it in real time. I was wondering, did he keep falling out of bed? But for me, again, and also looking at it, that bed has restraints. In most facilities, you can't have restraints on these beds. So they should have had a fall mat there. That's number one. And the bed should be lowered to the ground as low as possible. And even if he does roll out, like there's something support there for them. I would also argue too, if in this instance, should the person have been at home if that was at all possible? Because you can have restraints in your home. You just can't, most facilities won't allow you to have restraints in the facility.
It's for his safety because he kept falling. He kept falling.
And to protect employees.
We didn't want you guys to get hurt either.
The North Carolina Department of Health.
I'm wondering if she means you guys get hurt picking him up. Because that's the thing. Like that's something else that people don't talk about. CNAs, nurses, and the back problems they have later in life because they're literally doing deadlifts all day long, right? If you think about that. And that weight is like, the average weight of a person might be 170, 160, whatever it is, right? All day long on your back, your lower back, what that looks like, that is brutal.
And Human Services tells us a mattress on the floor is acceptable if indicated and ordered by a resident's physician.
Again, and that's what I said at the beginning of the video. Like some of this stuff is like they're just, hey, I don't like this. But the other part of it is, sometimes there are no alternatives. I don't ever think a hospice patient should be put on the floor in any situation. I think that a lot of times the facility does have to work with the families or figure out a way that they can get them home with restraints on those beds, because the hospice can follow you home if they're saying no restraints on the beds, because the restraints on the bed will stop them from rolling all the way off on the floor. And also floor mats. You guys, hospice companies, stop cutting corners, right? Go get floor mats. You can get them off of Amazon. They're not that expensive. I'll tell you what else works well that are similar to floor mats are those gym mats. Like my son did gymnastics, so we bought those gym mats in the house. We can flip on those. Those are also very cushion. They have a lot of cushion in them as well. Very similar to those floor mats. In this case, they could have done a better job in helping facilitate that patient either get home or somewhere where they could have had restraints on that bed. And also they could have put some floor mats in place. Putting a patient on the floor to me is a lack of dignity. I don't like it. If I were ever asked as Precious Hospital, we do that, the answer is going to be unequivocally, hell no.